I would like to introduce eMedica, controlling diabetes. Why should one obtain for a device like this? Why not just be dependent on the medicines? I don't claim that you should quit your medicines, but I claim that you need to reduce your stress of the medicines. Do not quit them, but reduce the stress. So what am I talking about? I'm talking about if you're having a 500 mg tablet, you need to reduce it to maybe 100 mg or maybe as low as possible, while controlling your HbA1c and your blood sugar levels. How do we do that? And what is a common problem with a diabetic individual? A common problem with a diabetic individual is insulin resistance. I'm talking about more than 90% diabetic individuals have this common problem. I'm not talking about type 1 diabetes. Even type 1 diabetic individuals would have this problem of having insulin resistance. What is insulin resistance? Insulin resistance is a fat layer which forms in and around the cell, does not allow the uptake of insulin, whether you have taken it orally or taken an insulin shot using an injection, or it was produced by your pancreas. This does not allow your uptake of insulin, which keeps your blood sugar levels high. Have you ever faced lethargic? Lethargic means you have low on immunity, you feel lazy, you don't feel like working, you feel very, very low. A reason of feeling lethargic is because when your sugar levels go up, your immunity goes low. What am I talking about? I'm talking about you're feeling lethargic. Please be aware, you're building cancer cells in the human body. There's a document published. Every diabetic individual is prone to cancer. You go to any cancer hospital, cancer institute, not all of them, but maybe above 80% people, you'll see they were diabetic. So am I saying every diabetic individual can be canceric possible, is developing cancer cells in the body? I'll say yes. When your sugar level goes high, you take an insulin shot or maybe you take a tablet, whatever you are, or maybe it's produced naturally by your pancreas. But what are you doing about how do you manage your electrical parameters? Your electrical parameters, your blood cells are negatively charged. The charge voltage of a blood cell is between -70 to -90 millivolts. That's a healthy cell charge. But when your sugar levels goes high, you'll end up reducing the cell charge. That is, your immunity goes low. You feel lethargic. What am I doing with eMedica? We pass electrons to rebuild your immunity to get the cell's voltage back to normal. One. What are we doing with eMedica? We burning the fat using a microcurrent, improving the uptake of insulin, allowing the insulin to be present in your bloodstream, like uptake is allowing opening the channels up, improve the insulin levels in your bloodstream, whether you have taken it orally or it is produced naturally in your body, and reduce your sugar levels. Not just reduce your sugar levels, that can be done with medicines also, but allowing the medicines to penetrate, improving your electrical parameters is very, very important. What else is it only that it is improving the electrical parameters? No. While I'm burning the fat, I'm reducing the possibilities of cardiac arrest. Every diabetic individual is prone to cardiac arrest. When your blood goes thicker and juicier, your heart starts pumping a bit more stronger. That means you're increasing blood pressure as well. Simultaneously, possibilities of a cardiac arrest, possibilities of a heart attack. I'm infusing a microcurrent and burning the fat, thinning your blood, without using a blood thinner tablet. A blood thinner tablet harms your kidney in a longer run, which I'm not doing. I'm burning your fat naturally. So I'm reducing the possibilities of a cardiac arrest. What else is eMedica doing? While I'm reducing the stress of the medication, I'm also saving your kidney. In a longer run, you'll land up in a dialysis center because you've consumed multiple tablets, multiple medicines, a blood thinner, a tablet for diabetes, it could be 500 mg, 1000 mg and whatsoever, because you're high intake of medication and that medicine gets filtered through your kidney. Your kidney is supposed to filter your blood. But what about those chemicals which are getting jammed in your kidney? Your creatinine level goes high and you land up rest of your life going to a dialysis center. Why not burn the fat naturally? Why not improve the blood circulation? Why not detox your kidney all through eMedica? eMedica is cleared its FDA, has its published papers, more than 10 published papers in medical journals, has a CDSO in place, has endorsements from various hospitals, about 50 odd hospitals, has endorsements from ICMR and many other organizations. Try using eMedica for your better health for tomorrow. Thank you.